Blog Talk Radio. Welcome to episode number 112 of Thyroid Nation Radio Live Talk Show and Podcast. I'm Dana Bowman, founder of Thyroid Nation.
And I'm Tiffany Milanich of GratefulGarden.biz.
That's us. And we were just giggling before the show started, so I need to get that out really quick because I had
You're
to sound
always
professional.
Giggling.
I know. We do have fun. We do. Okay, today we are talking with board-certified gynecologist and obstetrician and expert in functional medicine and women's health, Dr. Anna Cabeca, about stress, the thyroid, and the activation of the HPA axis, inflammation, all kinds of goodies. Can't wait.
Can't wait. And it doesn't look like she's quite with us yet. This is a hot topic. You know, I think there's so many patients that hear that HPA axis thrown around, and they're like, "What is that?"
Right.
So we're going to have her define the whole enchilada.
Serious, because
Dr. Cabeca.
Right? I mean, it's a big deal.
It's a big deal. It is big.
And I didn't know anything about it when I first started Thyroid Nation. I didn't know anything about the HPA. I'd never heard of it. And mine is definitely needing some work. mine's whopper job. My axis is not properly aligned right now, I can tell you.
Axis is imbalanced.
It is. It definitely is, right?
Well, I mean, and that's the stress, and, there's all kinds of things involved. The adrenal glands, the pituitary glands, which is, that's a big deal. So we are super, super excited to hear from her.
We are.
And it looks like she is with us. So let's get this amazing doc and woman with us and get this Thyroid Nation thriving. Good morning. Dr. Cabeca, can you hear us okay?
Oh, good morning. It is great to be here with you.
All right.
Hi.
How are you today?
I'm very good. How are you?
We're doing wonderful.
We're good.
I'm eagerly awaiting the fall. Let's just admit, I'm just not a heat person, so I'm super excited. I'm like seeing beautiful colors in my head of autumn trees and waiting for the cool.
That's so funny. When you said that, I was like, my immediate thoughts went to the kids are back in school. We have to celebrate.
Right?
It's so funny. I mean, everybody feels like that, and it sounds terrible. It's not about that. It's about the routine. It's really about the routine. It's not about we're trying to get rid of our kids. I mean, it's about the routine because it's great and it's fun, when you have summer and everything and you get to do all these cool things. But then everybody falls out of a routine and then, things just don't flow as well. So when school starts, it's like, yes, everything falls back in place, right?
Absolutely,
that is true.
Yeah.
My kids are homeschooled, so we're just kind of on this annual dysfunction. And no schedule. Yeah. No, I'm half kidding and half not. But so, Dr. Cabeca, where are you calling in from?
I am calling in from St. Simon's Island, Georgia.
Ooh,
Georgia. And so, what is the weather like there? Can you feel some fall in the air, or not quite yet?
Oh, no, 90 and humid. I think 90% humidity. Yeah, the air is thick and moist. Yeah, but we've got some sunshine today, and that's super nice. Always.
It's crazy. I was reading an article yesterday on the heat and humidity. They had some, 20,000 acute renal failure deaths, and I think the article was referring to Spain or something like that. I don't remember exactly, but because of lack of properly hydrating. So everybody make sure that you're keeping well hydrated. I know in Joshua Tree here we've had a crazy summer. Not so much the numbers, but a lot of humidity, which of course changes quite a few things as far as dehydration and all that is concerned. But it was an interesting article. I was like, wow.
Scary.
Right?
Yeah, very.
Very much so. All right. Well, let's jump in.
I can hear us all breathing. We were all, should I go? Should I go?
I'm
sorry, I
taking
kind of took a left turn.
Take a
took
sip
a quick
of water
left on that one.
one.
Okay. So anyways, we always start out, if you don't mind, with, people's a little bit about their journey, how you got involved with health and a little bit about you.
Yeah, I'm happy to share that. So I am a Emory University trained obstetrician and gynecologist, can't speak today, and I have been practicing medicine and specialized in women's health for over 2 decades. I originally from Pennsylvania, great place to grow up, and I settled in Southeast Georgia as part of a National Health Service Corps scholarship and repayment program that I had for receiving the scholarship through medical school. I had attended an osteopathic medical school, and I really entered the practice of medicine with a concept of a holistic concept, as well as a upbringing in food as medicine. I mean, I grew up with eat this to help your belly. You eat this to make you smart. You eat this, if you're feeling under the weather, right? And so I grew up with that, and the osteopathic medical system, we really learn a physiology and physicality to improving our health, which was very useful, especially in women's health. And I have always loved to empower women to heal their bodies, and men, of course, but definitely there was a discrepancy when I was growing up as a teenager in the 80s, looking at the research on women's health and men's health, and I knew that I wanted to definitely forward women's health. And through that, and practicing in a small town, a shrimping village, we're on the coast of Georgia, about 5 hours from Atlanta. So we are right on an island, really, off the coast of Georgia. And in this setting, and where I had my practices, it was really about giving women care, the right care at the lowest expense to empower their body, right? To really make them the divine healers of their temple, so to speak, and to really heal from the inside out. And being in this kind of solo practice, I really got to see my patients again and again and again, and not having specialists to refer to. It was about getting to the bottom of the problem, so we didn't have to go down multiple different routes and specialists and hospitals as much as possible, right? And that just led me naturally into bioidentical hormones and functional medicine, and using nutrition and lifestyle management, and definitely bioidentical hormones. And an area of my specialty and interest with sexual health is how do we cure that evading libido? How do we improve orgasm pleasure? How do we keep our womb, our uterus, healthy to have healthy pregnancies and healthy through menopause, so we can keep our womb, so we don't have to experience hysterectomies and removal of the ovaries and diseases that we may experience as women. And so how do we heal that? How do we avoid it completely to begin with? And so that was my professional journey, but as God has a sense of humor, in my personal journey, I experienced many of these trials and tribulations as well, and including, I know you know that we lost our son when he was a toddler in a tragic accident, and that brought, tremendous grief, despair, and depression into my life, as well as many, many physical ailments and infertility. I was diagnosed completely irreversibly infertile at 39 years old with premature ovarian failure and premature menopause, and I was told I would never be able to have another baby. And that was devastating to my husband and myself and my girls, and definitely to my soul and my spirit. And that took me on a journey, really, literally around the world. I left my practice for a year, and I traveled around the world and learned different healing modalities. And lo and behold, I came back pregnant, and I had my daughter Ava at 42 years old. And since was able to really help other women, even diagnosed permanently infertile have children, and other ways that we incorporate restoring the hormonal communication system that is often disrupted by stress to achieve balance and really optimal health and energy and vitality and our sensuality, and incorporate those aspects into the life that we can have.
Wow.
So, yeah. So now Ava's 9 years old, and so I'm 51 with a 9-year-old, and oh boy, I was so happy to see her off to school.
Wow, that's a miracle baby, though. That is.
She is. She is. Oh my gosh, she absolutely. Light of my, definitely all of our gem for sure.
Wow, that must have. When you found out you were pregnant, that must have been.
That's what I was going
to say. An extraordinary day. You know what I mean?
Actually, it was terrifying, to be honest. It was terrifying because at that point I said, and I was bleeding that first part of my cycle and of my pregnancy, the first 3 months of my pregnancy, and I thought every day I was going to lose her too. It was terrifying. Yeah, and so, it's been a journey. It's been a journey, but yes, no, I say I did everything I knew how to do as a gynecologist and obstetrician, and did everything I knew how to do as a child of God, and ultimately it was in His hand. So I just, she is a miracle baby. She's named Ava Marie, and she, it really was that trial, and it kept coming back to create this as much as create the healthiest environment you can create for this child, so, and that exists inside and out of the womb, right?
Absolutely.
That's right. I can resonate with that. I'm a HELLP syndrome survivor with my first child, and they told me I couldn't have any more kids, and went on to have 3 healthy girls, and so I kind of, I always, did that. Yeah, but if I get pregnant and I survived the first one, and the physicians kind of look at you like, is she stupid? But then you kind of stick your tongue out afterwards and say, yeah, but I had 3 healthy girls with no problems, and so it's amazing. I mean, I think sometimes I tread carefully with this statement, but sometimes medicine, of course, they make things based, determinations based on statistics and stuff like that. But that sort of loses the power of the human spirit and, the creator that ultimately makes those decisions. I don't know. I don't know. But, wow, that's just, amazing. All right, well, let's jump right in, if you don't mind, because I know that a lot of times patients will hear things, and, of course, HPA Axis gets just tossed around like crazy. Can you tell us what is it and how it works with the thyroid in particular?
Well, if you think about health as from the top down, I mean, we talk about the HPA axis. Really, we look at it a little bit longer than that, so it's a lot more initial. APA TG axis. So we're looking at the hypothalamus, so from the top down, so from within our, within our brain, where our communication system starts, and that's really key. So our hypothalamus and our pituitary, those are the 2 key areas, origin of many of the stimulating hormones that we get to produce our hormones that are circulating, but it also affects our adrenal glands, our thyroid, and our gonads, right? So our ovaries in women and our testes in men. So we have to, it's a combination network, and this is something that's so important when we think about this. It really just a communication system, like in a family. It's a family of hormones. You've got mom, dad, the hypothalamus and the pituitary, and you've got the kids, and there's a crazy aunt and crazy uncle in there somewhere too, for sure, not to mention, it goes on. But so you've got this family of hormones, and the way that our body communicates with it is a feedback. So we're going to give out instructions, and then there's a response from our ovaries, from our adrenals, our thyroid, and that communicates back, and it will either encourage more response or a shutting down action, and sometimes something in between as well. And so it's really, it's really important. And something to emphasize as we think about our ovaries, our gonads, what we now know, which we didn't believe when I started my practice as an obstetrician, but what we now know is that even our menopausal ovaries, our ovaries over 50, 60, over 65, are still part of this intricate communication system. And that's really a key thing to understand, is that, this is a intricate communication system. But for women who are listening who may have had your ovaries or your uterus removed, don't worry. We've got our adrenal glands, and they tend to pick up the slack. And so the adrenal glands, and I know you talk about this a lot because they're so involved with the thyroid, are just a really key gland that's part of this important communication system. And it's going to be producing cortisol. We're going to get DHEA, an important hormone precursor to the androgen testosterone, also precursor to estrogen. And so we tend to see, these precursor hormones pick up when our ovaries, et cetera, decrease. So not to worry, and there's this natural transition that we go through as our gonads decrease, called menopause in women, andropause in men. And it's just the opposite extreme as when we started our periods, the opposite crazy, right? That from when we started our periods and now we're ending our periods, and that's the menopause. So from menarche to menopause. And so there's a constant. There's a daily cycle in hormones. There's a monthly cycle in hormones, and then there's a lifetime cycle in hormones too. And so kind of looking at the big picture of what's going on. And my expertise now is in this menopausal time period, the time before our periods stop, and onward, and what our body needs attention to as we continue to live, thrive, exist, So it's a pretty cool system.
I like that, the opposite crazy.
Right. But it's as important. It's as
right?
important.
No.
Yeah.
Is there a magic age for, you hear people going early and some that go much later? Is there a magic time frame for that perimenopause, menopause?
Yeah, and I really think there's definitely a genetic and environmental component, right? In our textbooks, it says average age of 52 for menopause. We tend to see the perimenopause, and typically 5 to 10 years in the perimenopause, or the time before your periods completely stop and they don't come back. However, in my lifetime of practicing in women's health, we've definitely seen a longer time period. Like women in their mid to late 30s are experiencing these, not so much as a menopausal transition, but this perimenopausal symptom. We get a lot. I think this is primarily due to the endocrine disruptors, and from toxins in our environment, from stress, right? Lifestyle issues and things we can control and things we can't can affect this transition period. But I definitely see it in our mid 30s to late 30s, but definitely around late 40s we're starting to see that premenopause symptoms. And for some women it's in their mid 50s, but typically by late 50s we've gone through menopause.
And it's confusing because sometimes people are getting, they're going to the doctor and they're saying, this is menopause, and really maybe some of the people are experiencing thyroid, adrenal, hormone issues, right?
Absolutely. Absolutely can be stress, right? And it can definitely be thyroid. What's happening, what we see, like in our mid-30s, we see this estrogen dominance type of phenomenon that contributes to an imbalance in our thyroid hormone, right? We start to see an increase in TSH at this time. And so our thyroid's under pressure to make more thyroid hormone, because as a function, partly sometimes due to this estrogen dominance issue, an imbalance in our reproductive hormones and our progesterone level. As our progesterone level declines, we start to see this imbalance, and that can definitely affect our our thyroid, not to mention, if we're on birth control pills, further dinging the thyroid into malfunction or hypofunction or decreased performance.
As a mom of a daughter who's 13, and after everything I've learned and all the radio shows and all the amazing guests, and you just kind of, mentioned the birth control component, and I have to tell you that is not going to be something that I'm going to push really hard for my daughter to do some kind of natural different things, because that is just scary stuff right there. It messes with all of your hormones. And I remember my friends even saying, "Oh, I'm so excited because I've missed my period, and or I'm on these birth control pills for my symptoms and things, and I'm so happy because now it's been 2 years since I've had a period." And I'm just thinking nowadays, oh, that's just crazy.
Right.
Scary.
Now, the more we know, right? And definitely endorse Dr. Lara Bryden here. She's with her book, The Period Cure, and just the awareness of how we can optimize our periods naturally and make them our friend. And the same with menopause. Like, it should not be something to fear. We need to embrace this time of our life. It really is a positive transition. Just like, like that fear, as can remember, or maybe even your daughter is experiencing this fear around the time of her periods are starting, that we as women, generally, there's a societal expectation of fear around menopause, but it's really a beautiful transition time period. And so how do we embrace this? How do we make it less scary? And how do we maintain, our sanity, our body temperature, our weight, our vitality, our memory, all of that during this time? And that's what, that's what I really am passionate about, empowering women to really love this time period and make it as easy as possible. Just like with girls with painful periods, heavy bleeding, it's like things like stopping the dairy, decreasing inflammation, removing the chemicals that we're putting on our body or that we're exposed to. We're even more sensitive in the menopause, and it's critically important that we avoid those things for this transition, and then do the lifestyle things like getting a good night's sleep, getting out in nature, putting your feet in the grass, grounding, getting sunlight naturally, and exposure to that, our natural environments as much as possible, because there's nothing in a pill or that I can write on a prescription pad that's going to do the same thing.
Right.
I was with my husband the other day during the eclipse, and we were staying out this beautiful park, and we were out there with some kids, and they were doing, they had the glasses, so they let us borrow the glasses and things. And I was like, "Take your sandals off. Let's stand in the grass. Let's stand in the grass with no shoes on." And so we did, and we experienced the eclipse and things. And a few minutes later, I look over, and he's got his shoes back on. I'm like, "Take your shoes off. Get your shoes off. This is the whole point, right?"
Right. I think people, as a general rule, they don't experience joy. It seems like we're in just such schedules and the throes of life that we don't take time to do the things that really just make us take a deep breath. I mean, for some people that's dancing, for some people that's music, for some people that's painting, for some people, everyone has a different thing that makes them take this deep breath. But it seems like, schedules are so busy and everyone's going and doing all these things that we don't take the time for that. And there's an enormous amount of therapy. For me, I know, in just doing things that I really enjoy doing. I'll never forget my sister, my poor sister, and I'm, of course, going to make a shout out to her, but when her kids were, they were little, but they were kind of out of that little phase. I think there's a transition of women where your kids hit a certain age where not really cruise control, but it's not as time consumptive as when they're very, very little. Mm-hmm. And so we were talking on the phone, and she was, she had a free moment, okay? And I said, "Well, what are you doing? What are you going to do?" And she's like, "I don't know. I'm sitting here in my car, and I called you." And I said, "Well, go get a pedicure. Go, what do you love to do? What do you love to do?" And I swear to you, she's like, I honestly don't know. Like, she goes, "I don't know what I would really like to do with this time. It was like a pivotal moment for me, just realizing how sad that was, that she didn't have something that she really had this drive to go do that just made her like, you know what I mean? But I think a lot of moms are, go through that.
Oh, I'm sure they do.
No, absolutely. And I think this is where we tie it back into stress. What's stress doing to our hormones, right? Stress is going to deplete our mother hormone, progesterone, which is a precursor to our stress hormone, cortisol, and also to DHEA and our reproductive hormones. And so that brings us to this point, like we're under stress, we're going to have less of our hormones that produce the juice of our life, right? The reproductive, the drive, our sexuality, sensuality. There's that aspect. But there also becomes a disconnect when cortisol is high. Our hormone of love, bonding, and connection called oxytocin is low. And then both can, after burnout, when cortisol is low too and oxytocin is low too, there's those significant feelings of disconnect, like you're not connected. You no longer feel, even if you've had a passion for, maybe this woman had a passion for painting or for going for walks or just feeling the sun on her body, or calling up a friend that makes her laugh. The things that you have passions for, you feel disconnected from. You feel disconnected from the work you love, the hobbies you love, the people you loved, and you don't know why. It's a physiologic response. So this behavior, this thought process is a physiologic response from stress that's caused this oxytocin disconnect, right? And that's really predominant in, as our hormone progesterone naturally declines in our 40s and onward, we start to feel that even more significantly, and it can make us feel detached in our relationships. Like, I know I love my husband, but I don't feel love for him. That sensation, I heard that from many, many women, and that led me to look at the science of what was going on there. And it's when you're stressed, you're burning, your petals to the metal, so to speak. You're burning the candle from both ends. We all do it. Our body just at some point can't keep up, and so you're driving the survival pathways versus the thriving, living, the juice and joy of life pathways. And so we have to really focus on that physiology, because that does create relationship stress, the most important relationship in our lives, and takes the pleasure out, and we want to bring that joy back in.
So that's a whole different big O.
Yeah.
Oxytocin. Yes.
Oh, my God.
It is. It is, absolutely.
When you said that, I had to giggle in my head. I'm thinking, that's another big O right there.
Yeah.
Yes.
So it's not that easy to replace. I mean, we hear that and we see that so often in thyroid patients, the loss of libido. I call it unplugged. Like that unplugged from my own body, someone who is, very lovey, very touchy, very, and just when I was diagnosed, it was kind of like I was unplugged from my own body, creativity-wise, and so oxytocin, is it that easy to replace, or how do we get around that? I mean, that seems to be the big question. How do we get our libido back? How do we plug back in?
Yeah, and it's a discipline and a practice. On my website, on my one of my blogs, actually my freebies page, I give a oxytocin quiz, and that leads to the 10 best ways to produce your oxytocin. And it's, how do you work naturally to produce oxytocin, to restore that? And lifestyle management is really key, but this is the key things that lead to longevity, lead to an increase in oxytocin and vice versa. We know oxytocin is a longevity hormone, an anti-aging hormone, and definitely, few physicians in the world really prescribe oxytocin, but the best way is to produce it naturally. And even if you look at, healthy marriages, healthy relationships, healthy sex life, oxytocin, right, that reconnects us. Pets increase our longevity. Having a pet increases our longevity. that is oxytocin. Laughter increases oxytocin, increases our longevity. So they run hand in hand. So definitely orgasm, the real big O, right, increases oxytocin. And really, intimacy, whether we have an orgasm or not, a climax or not, increases oxytocin. So those are some really good ways. Massage, physical touch, hugging increases the trust hormone, oxytocin. Oxytocin is also known as a trust hormone. And that is key because physical changes that are happening in our menopause, like vaginal dryness, that can cause discomfort during intercourse. We got to conquer that, right? That's like one of my missions in my life, too. We're going to eliminate vaginal dryness. And that can, so we start to lose that sexual piece of our lives, and then we're feeling less and less connected to our mate because that piece is missing. And I always tell women, if you have pain every time you have sex, why would you want to have sex, right? Whether it's conscious or unconscious, and mostly it's unconscious. Women just don't think the reason I'm not having sex is because it hurt, I had a discharge afterward, I had a bladder infection, it felt irritated for days afterward, or whatever the situation is. We don't realize, put two and two together, but it's absolutely in alignment. So healing the vaginal and vulvar tissue and keeping that healthy is a big part of, certainly part of my mission, but helps to keep that piece in. And it was beautiful. You girls would love this, that I had we just published her testimonial on our blog, a beautiful 71-year-old woman. Her name's Kathy. And she has been using my cream called Julva, which is a topical anti-aging cream for the vulva. And she's 71. She says she's been married this is her second marriage. She was widowed, and then this is her second marriage, and for 20-something years. And they have sex once a week. She goes, this is so important for our, for love, for relationship, for health, for the quality of our lives. And I just think that's, and she is shouting that out through our testimonial that we've had with her to the world, because it's such an important piece of her anti-aging, right, to aging gracefully, so to speak. And it is important, but so many women, and so she's the exception, not the norm. I'd love to see that as the norm.
Right. I think it's more important, I think it's kind of that subject that, Danna and I, we've had this conversation a few times, but I think it's a subject that like every woman feels and no one wants to talk about. You know what I mean? It's like you have a tendency to feel like you're the only one in this situation, and I think it's way more prevalent in women than we realize, I mean, so much is put on men's sexual health, and how to do these things for them and everything else, and we're just have never been at the focal point. You know what I mean?
Definitely.
Oh, yeah. And I was just thinking as you're saying this, that for women who are listening, you're not the only one, right? Other women are experiencing this. When we surveyed our list, and 78% of women are experiencing vaginal dryness, discomfort during intercourse in this age group 40 and above, and incontinence, leaking. No one wants to talk about it. I talk about it all the time. People go away when they see me coming. No, I'm kidding. I'm like, we're going to heal this, right? And it's not just, we don't just want intimacy, like for my client Kathy, was that it's pleasurable intimacy. Guys get to have it, but women feel like they don't, right? And so we got to restore that pleasure aspect of our lives. Like, what gives us pleasure? Certainly, we want pleasurable intimacy, not just intimacy. We want pleasurable intimacy to take away the pain component, take away the, okay, this is just one of those things on my to-do list that I have to do to be a good wife, right, or partner, whatever. And so we want to really create this pleasurable experience. And everything we do, how do we approach this with pleasure? How do we approach this? Even like thinking about this morning in my carpool line with pleasure, right? Okay, my car's a mess. I'm just going to enjoy it, right?
Right.
And how can we do these things with pleasure in our lives and bring out more oxytocin and bring more joy back into our life, and that we don't say no to these joyful moments and opportunities, that we're actually embracing them when we have time. Like the woman you said in the car, she has time to do something. How do you bring joy into that moment?
And there's also the component of, when you're finally alone, okay, it's like one more thing that someone needs. I don't know if anybody else feels that way.
Yeah.
But it's like, you know what I mean? Rather than flipping it around. I mean, I'm definitely guilty. We're going TMI here, girls, because I think that's important. I think there's such a social stigma around it. Rather than looking at it as just a need of another person, what about me, right? Oh my gosh, it's you know what I'm saying?
Yeah.
Instead of looking at it as just a need from another person, it's actually in my own head, I'm the one that needs it, to be honest. And what's funny is my husband knows that, right? But it still just feels like he needs it. You know what I mean? I need it. I need it probably a lot more than he does.
Well, yes, you absolutely do. And he wants you to experience it. This is one of the things. I have a program. It's called I have a free webinar. It's about an hour and a half of really great content. I think every woman, every couple should hear this webinar. It's called Help Doctor, My Sex Drive Has No Pulse. So it is at my drannacabecca.com/help doctor, and it's a free webinar. But it's I give some of the secrets that men and women, need to know about each other. But one is that, he wants you to be happy. His goal and I did a survey one time. I just asked every man I knew, including some of the most chauvinistic men I knew, like, what is your, what do you get out of, sex with your partner? What is the thing? She goes, well, when I know when she feels good, I'm happy. If she climaxes, I'm happy. It's not like, I did. And this was universal. It was not about him. It was about her. Certainly there's his aspect there, but he has done his job when you have experienced pleasure and you let him know. He wants to make you happy, and that goes in and outside the bedroom. And I think we miss that as women. So absolutely, it is for you.
Right.
And
we got to demand that. I have to shift
a little selfishly.
My mind frame.
Yes.
It is. It's a mind frame.
Sexual health.
Mental sexual health. Love
Doc,
it.
I am we'll call it sexual DOA. Rival. Oh my God. I need to be
but you need it. Like it's like an innate need. Like you don't realize, but all the things that come with it and from it and all of that, you just don't realize that you need it, even though it doesn't seem like you need it. Does that make sense?
Yeah.
Or want it,
no.
or whatever.
For me, it's like it's again TMI, right? It's. But we've got the expert, right? So I'm going there.
Yeah, go.
For me, it just takes me so long. Like I don't mean like orgasm-wise. I mean the mental preparation that goes into it until I'm actually relaxed. Like you're looking at 45 minutes. You know what I mean? So half the time I'm like, I don't have time for this, right? I'm not one of those people that can get that kind of pleasure. I can literally feel the oxytocin like completely surge through my body. It's pretty awesome. But to me, it's like it takes so much time. So if it's during the day, it's like, okay, there's no way I'm going to have time doing this because I'm thinking about the kids' needs and things like that. And then to the end of the night, I'm toast. Girls, it's like, it's like I must have this look on my face to my husband like, yeah, don't even think about it. I'm tired.
Don't even look at me.
It's over. It's so true, right? And I'm sure that I'm not the only one. I mean, especially with thyroid, at the end of the night, my kids have videotaped me. This is how bad it is, okay, of me like having a conversation with them.
And falling asleep.
Because they're like, Mom, it is so funny, right?
I know. I used to do that
mumble.
too. Me too.
They'll be like, we all know that we can ask you whatever we want to ask you when you're at that
God,
point. Like I have this zone. Where they're like, we can get you to agree to anything at this particular, and they have videotaped me, I swear to you. It's like, oh my God, why do you do that? Because it's funny. They're like, But so that idea of intimacy at that point, it's like, Are you kidding? It's a complete deficit of energy. So, any helpful tips, Doc? How do we flip the switch on that?
Yeah, definitely. It's because first of all, you're not alone. No, you are not alone. That's a very common phenomenon. In fact, in my medical practice, as a gynecologist, I would ask, women, do you have how's your libido? And most of the time it was non-existent or very low or whatever the situation was. But I started hearing, but it's okay once I get there. Like once we start, I'm okay.
Right.
And that's the reality. Women experience a secondary sexual response, men primary, right? And they're off running, right? Think of the Autobahn in Germany. It's like fast and furious, right? You're off. It's a straight line. Women, we're like the Romantikstrassen or the scenic route, so to speak, right? We're kind of tentative. Let me look at the sheep for a while. Look at those pretty flowers. Okay, let's get going, right? But it's that kind of, or if you visualize the board game Candyland, that's my favorite analogy. It's like sometimes, the game Candyland, the kids' game.
Right.
Yes.
Oh, yeah.
Yeah. Oh, yeah. So it's like, sometimes you're stuck in the mud. Sometimes you've got ice cream cones. Sometimes you're back at the beginning. That is a woman's sexual experience right there. And that's so true. But once you get started, and the primary interest, like a man, it's not there, and especially not as we get older. But the secondary interest, once we get started, we're feeling intimate. We've created this intimacy ritual and massage, touch, play. Then you're like, okay, I'm into it now. Maybe it's taken 45 minutes, right? But maybe it's as we start to accept that, okay, I'm normal this way. I mean, let me just. And you've communicated what you like, what feels good, and your husband's all in, or can do like a orgasmic meditation technique or something like that to kind of just give your body this openness to experience pleasure and know that it's for you. So just those two shifts. Number one, just become receptive, know that this is for you, and to experience pleasure. Completely, eliminate as much as possible, eliminating distractions from your mind, and say, this is for me, this is my time, this is going to give me oxytocin, restore that intimacy, love, and connection, fan the flames of my relationship, so to speak. And also, maybe it's also that anti-aging hormone, the natural weight loss hormone, will make me look younger hormone, all those other good incentives are like, okay, I'm in. Right. Through those other reasons that, may motivate us to say, okay, well, I need this pleasure time for myself. And that's key, just recognizing that it is absolutely normal. The Masters-Johnson sexual response, not for women, right? It's actually, there's Dr. Basson did the research on it, and this is our secondary sexual response, and that is what we experience, Candyland, basically. So be open to it, have fun with it, and keep kind of rewiring into the moment as an active participant. Okay, this feels good. Love it when you do this. And just kind of opening up and connecting. And then again, in my webinar, I talk about women and men. And the thing is, oxytocin affects us differently. No big surprise. Women and men are very different. Mm-hmm. And oxytocin will make your man roll over and go to sleep, right?
Yes.
Good night. And what we need at that point is the intimacy and connection. We need 2 minutes of love, bonding, communication, continue caressing, just, bring that in. That intimacy connection will keep us coming back. So even telling our spouse that this is what, before you roll over and go to sleep, babe, I need some loving words, encouragement. I need to talk. Let's maybe it's about what we've loved and the experience. Maybe it's what came up for you. Maybe it's like, hey, I just want to let you know that these are the things I love about you experience, or whatever you guys come up with, play with. But to have 2 minutes of intimacy for women, because ultimately that refusing that, refusing, like putting together, to fuse together our relationship is key, is a key reason, a key motivator to have another intimate experience with our mate. So I think that those are really some key points. So let me know how that works. And then if not, I've got a whole nother bag of tricks.
Will do.
I love that. So I was going to ask you, for the women who are listening that are just going, yeah, I just can't, like they're so exhausted. I wanted to ask you about testing. Like, do you have, favorite testing on this whole, thyroid inflammation that, HPA Axis to know, okay, this is where we're going with this. Like, because you hear so many people say, well, I take these bioidentical hormones and that helps my sex drive. So for the women that are just so fried, they're just at the point where they're like, just can't do it. Is there any testing they can get? Is there anything that you would see that would go, okay, you got to start here before you even remotely feel like doing this? Like, is there a point like that for you? Does that make sense? I was like all over the place on that one.
Oh, no, I completely followed you, so I was all there with you.
Awesome, perfect.
So, but, definitely there is some key testing I like women to have for sure, and men, but there's some key testing, and I'll mention those. But it's key, like with oxytocin, and it's just like it's a discipline and practice to bring into our lives. It's a shift in our mindset that has to occur. And I'm coming from the experience of being a PTSD survivor. And so for me, I always had this prior to our trauma, I had this, glass half full mentality. My mom said I look through life through rose-colored glasses, la vie en rose, she would say, and that type of positive personality, right? But post-PTSD, it shifted. I was fear-based. And so I've been able to see my different, personally, but then now having experienced that, I also saw it professionally in the clients that I saw. So it's important to just start to a mental discipline to focus on the positive, to I see God in that person, to see where do I experience love today? Where can I be more loving? And those questions, like I call it my end of the day, check-in, right? Like how, where did I see love today? Where did I experience it? How could I be more loving? And those type of check-in was a discipline for me. So it wasn't something that was natural anymore post-trauma. And so we just have to start shifting that mindset and taking it into that focus of love, hormone of oxytocin, and experiencing more than that. What could I have done more loving today? And things like, but not in a condemning way in any way, but love, gratitude, and just to pull out the beauty in our lives as much as possible. Because sometimes it's hard to see it. Sometimes our thyroid and our serotonin and our dopamine are in the dumps, and it's hard to see light at the end of the tunnel. I know that. And so it does become, part of it is a mental discipline, and then getting your physiology. So for me, progesterone, I created a cream. It's my Pure Balance PPR cream, and it has progesterone and pregnenolone in it. These mother hormones are really important, especially like if we have PMS, to use at the latter, in the luteal phase of our menstrual cycle, and in the menopause, right? In the perimenopause and menopause, adding some progesterone to just, like, so to speak, cushion the fall of the hormones, and giving a little bit. And I created a transdermal cream that's all natural, that's really nice that way, but with USP, progesterone, and pregnenolone, high grade. And it works. So there's that hormones that we can need, and I'll tell you how to test for that too. But symptomatically, we may feel that PMS, anxiety, mood swings, hot flashes, brain fog, like end-of-day brain fog, like you experience, like you feel like the kids know when to take advantage of you, you're exhausted. That's usually progesterone, and that's a test in and of itself. How much do the kids take advantage of you? Check. And the other thing that I use a lot is DHEA, and that's something to test too. And that's one of the things that I use in my clients, a cream called Julva that I created to help women with vaginal dryness, vulvar atrophy, those symptoms of our feminine bits aging, right? As important as wrinkles around our eye, it's keeping the pelvic floor healthy, and especially because, again, when we experience dryness, we're less able to experience pleasurable intimacy, and we want to keep that pleasure there, and that's an important piece. So I created Julva for that, and that has some many beautiful natural ingredients in it, but also has a precursor hormone, DHEA. And so I test for those two key hormones. And if you're cycling, you want to look at cycle day 21, and you want to look at your progesterone level, your peak progesterone level during that time. DHEA you can check throughout the cycle at different times. It's fine. But typically, if I'm looking for peak hormone levels, I want a 21-day progesterone and a DHEA level, and I want to look, of course, at all your thyroid hormones. There's a website where I list all the hormone tests that I do, my elite hormone panel, that really spells out a very comprehensive testing, and that's at ultralabtest.com/Dr. Anna Cabeca, and you'll see my entire list of hormones. But the key ones that I'm going to look at are progesterone, and at day 21, or if you're in menopausal anytime in the morning, and if you're on hormones 6 hours after your hormone dose, and we do that consistently because I want to know the situation in which your blood levels are being tested. There's other ways to test urine, salivary testing, other reasons to test in those ways I won't get into here. But I was telling my clients, I'm a gynecologist, but every body fluid is going to be under evaluation. So at some point or another in your lifetime with me, right? So different body fluids do tell us something about hormone levels. And I want our listeners to understand we haven't begun to understand how to assess our hormone levels well, because hormones are energetic molecules. They interact, they cycle daily, hourly, weekly. We get these monthly, certainly, and as our lifetime goes. So there's a shift. We're getting closer. We're definitely better than we were 2 decades ago, but the hormones will tell us different things about our body. So progesterone, DHEA, testosterone, free and total testosterone, those are important. Our estrogen levels, including estradiol, and our sex hormone binding globulin when we're looking at hormones. But typically, let's look at DHEA, and we want that number, DHEA sulfate in the blood. When we're looking at it in our blood, it's called DHEAS, and we want that number to be above 200 to be somewhere between 200 and 300 in women. Typically, it's in the teens or under 100 when I measured women over 40, and it is a hormone that is important. It's an important, as our ovaries in women and testes and men give out, our adrenals have to pick up the production to a certain degree in that leveling and balancing of our hormones. And DHEA is that precursor. So I often use some transdermal DHEA, as in my Julva cream, now to help women and men as well. So that's an important way to look. But there are other key, like when I talk about hormones, and I do a program called Magic Menopause, I want to say estrogen, progesterone, testosterone are our most important hormones. I'm a gynecologist. Like, these hormones I hang my hat on, right, for reproduction. But actually the most important hormones are cortisol, insulin, and then the crowning hormone that makes everything worthwhile, oxytocin. So we've got to really get cortisol and insulin in balance, because they are going to disrupt our entire HPA TG axis, right? So that's an integral part of my program, getting that straight, and something I call keto alkaline. I want to get a ketogenic type diet, but that's alkaline as well. Combining those two are key to really optimizing those hormones, cortisol and insulin, so they work for us and not against us, because they're such important hormones. And then that helps our other hormones stay in balance better.
Okay, lots of great information.
I know.
I feel like I should take
My head
notes.
is reeling.
I feel like I should take notes, and then I'm thinking, well, I could just listen to this again.
Listen to it again, right?
Right, Okay, so what are your thoughts on, if you have all of these things, digging at the root cause and trying to figure out what they are, and going that route, and then if there's no rhyme or reason or whatever, then heading to the creams and the natural, topicals and things like that.
Oh, absolutely, absolutely. So in my medical practice, I've since retired my gynecology practice, but one of the first things that I did with my clients was a detox program, 21-day detox, right? So it's modified elimination diet, using some functional foods to help your body detox, support your liver, because that is our hormone metabolism factory, and clean up our gut. We have to get to the root issue, and over 90% of the root issue is starting in our gut. So we have got to address that issue. And so what I experienced in incorporating this functional medicine approach in detoxing the body, healing the intestinal tract, getting kind of cleaning up that way, that when my clients came back for their lab results a few weeks later, 90% of their symptoms were gone. So we have to. I still am a big advocate in using bioidentical progesterone pregnenolone cream, especially through the transition and thereafter of menopause. It's just over and over again, I see the benefit of that in our society and the way we live as Americans today, especially. That additional support just makes life better. So, but
and
I
transdermally,
also use herbs.
you feel like
maca.
I was just going to say transdermally, you find is the best way to get that, correct?
No, not necessarily. I think that I use transdermal a lot. Number one, because I have my Pure Balance cream and it's over the counter at the low levels that I use. But I think the transdermal definitely has benefit. You're bypassing the liver. But many times I've used oral progesterone, prescribed oral bioprogesterone, because it can increase the deep sleep that we desperately need at certain times. So I've used oral in my in patients postpartum for postpartum depression, postpartum blues. I've used it to help women in the perimenopause and menopause orally. Sometimes I'll use both oral progesterone and transdermal in combination for certain reasons. So there is definitely some benefit to bioidentical oral progesterone as well, and we can use both for different reasons. So I lean towards cream now for a couple reasons. One is that women are more intelligent than sometimes the medical system, certainly the insurance companies, give us credit for. But we know when we need more and when we need less, too. So there's that, ability to tighter the dose of cream a lot more.
You have more playroom.
I learned this from my yes, absolutely, and I learned that from my patients as they got more in tune with their body.
We have this waxing and waning of hormones that is a very natural thing. It's not like, we would be driven all the time. I mean, we had a window of high progesterone during the month. You know what I'm saying? I love that. I really do, because I have very low DHEA, and I'm super, super scared to take it orally for exactly what you are saying. It's like, do I want it high all the time? I don't really. Is it supposed to be high all the time? And of course, my physician, God bless them, they're really not that interested in it, because I'm still within the normal range. But of course, DHEA range is huge. But I'm in the very, very low end of the normal range, and my hormones are good. So they're not willing to have that conversation. Does that make sense? So that leaves me kind of in the guessing point. And I'm like, I don't really want to guess with this. So I totally can wrap my head around what you're saying of having more playroom with that, meaning that you can use it during certain times and then not at others, right? That's
right.
I like that.
Yeah.
I'm buying the cream.
And the issue, right. Oh, well, I'll send you some. Yeah. So one thing is that, my cream Julva, which has the DHEA in it, is intended for topical application, right, for our feminine bits, for our pelvic floor, but it can be used anywhere, so that's a good thing. But one of the things I want to tell you is that we need to really understand that our labs are giving us normal results, not optimal results, right? So they're going to tell you they're giving you normal ranges, not optimal ranges. So for our clients listening, our normal range is sit outside of Walmart, I think, in Southeast Georgia. Sit outside of Walmart. 8 out of 10 people that walk in and out of Walmart are your normal comparisons on your blood work. Do you want normal labs or do you want optimal labs? And that's an important thing to understand. Yes, I'm shopping at Walmart too, but I want to be the optimal one walking in and out, and an optimal body weight, energy, happy, all these things that that are really important. And so we want those optimal lab values. And unfortunately, and I learned this in 1999 when I ran my first testosterone blood test on a client, and her 63-year-old woman, and her labs came back testosterone 0, normal.
Wow.
So I'm like, what? How can 0 be normal? This is alive, I mean, what? And so that's when I started doing labs, studying labs. But I had the experience of being in research for a couple of years before I went to medical school in physiology research with the Navy. And so I was really into getting to from that point, getting to the bottom of things and understanding the physiology. And men and women are very different. The testing that was still even employed today is sensitive enough to test, the male levels of hormone, but not the female levels of testosterone. So now we have much better ways for testing women. So that comes again to what type of test are you ordering. So in my panels, I'm very specific on what type of test I'm ordering. Like I'm ordering testosterone, but there are 10 ways to order testosterone. I want it read through instead of mass spec, or what type of way am I reading these results? How is it being analyzed by the lab? And that's important. And that's where, many times we're like, oh, well, you're normal, but, what does that mean?
Right.
So,
right. And I'm very low with all of that. DHEA, cortisol is low. Progesterone, all of it was low, and then I remember one of my doctors suggesting pregnenolone. I had to break it open and take just a little bit of terrible cystic acne, terrible over the top with any of those supplements.
Yeah.
So I'm wondering if maybe transdermally some of that stuff might be better for me. Right?
Yeah, and absolutely. I experienced the same thing. And so for transdermally, and if you experience acne from either topical DHEA or progesterone or pregnenolone, you want to just make sure you got enough zinc circulating. So you can check a red blood cell zinc. That's one of the tests I like to look at, and you want that number to be greater than 5. So what you want to look at is your red blood cell zinc levels and see what those levels are. You definitely want those optimal, and even supplementing 30 to 60 milligrams of zinc a day is a good thing to do, especially if you're prone to acne. So.
Okay. Well, I just started taking zinc, so I'm feeling pretty proud.
Yeah, good. You're on it. So you experience that.
Now, DHEA and pregnenolone, they're both stress hormones, correct? I mean, these things being out of whack are kind of like a great indicator to say your stress management is not efficient. Yes?
Well, there's that, again, progesterone and pregnenolone too, and DHEA, they all naturally decline as we age. But consider this, and this is something that, I learned through my research and my personal experience as well as professional experience, is that women who have had PTSD, who have had trauma, experienced childhood abuse, veterans of war, women as they go, if they've had these experiences earlier in life, when we go through, I'm in that group, when we go through menopause, we have a tougher time. So why? I had to ask myself why. And the progesterone is our brain protective. It is a neuroendocrine hormone. It protects our brain. It is important for our well-being, our sense of enjoyment, our calm, right, our memory. Progesterone is so important, progesterone and pregnenolone, so important in these realms. And when it is declining in our mid-30s, we lose that protective layer, so to speak. So we, adding that, again, cushion our fall. I look at progesterone as cushioning the fall. So adding that layer of protection in from the top down, that is really important. Progesterone, pregnenolone are mother hormones that cortisol is derived from. DHEA is derived from. Estrogen and testosterone are derived from. So, our bodies are intelligent. It can take it where it needs to go. Again, in the face of incorporating the healthy lifestyle, good nutrition, getting out in nature, all those things have to come together. There are many pieces of this puzzle that come together to make us, to optimize our health in a in a healthy way that we need to put together. So I think that's where I think that's where we really struggle too with the now in with the high levels of stress from watching the news, from I'm 51 with a 9-year-old, from whatever you're dealing with in 2 in college, right? And so you've got all these other, and so sometimes we need that additional cushion because there's only so much we can have external control in our life. So it comes down to that, thinking well, right? Focusing on gratitude, attitude of gratitude, and additional hormonal support. And again, I also use nutritionals and like maca and alkalinizing our body, and that whole it's a lifestyle, trying to incorporate a lifestyle based on our design and incorporate that into our environment, our life, and our families as much as possible now, to really put it all together, because it's never just that one thing.
Mm-mm.
I think I went
never
tangential
just that
there
one thing.
too, but
I love under your store, Dr. Cabeca, you have the for the Pura Balance PPR cream, you have Mama's Little Helper. I love that.
I do too.
Oh my goodness.
And I took the quiz.
Did you?
I did. I went and took it. It says I need to increase my oxytocin boosting activities on a daily basis. So, it said mine are suboptimal. So,
yeah, and again, with this HPA Axis that we talked about, when the thyroid's down, there's still what's caused that to hit, what's caused that to hit. Where is that coming from? So keep digging in, but adding the disciplines and the practice of bringing in more oxytocin, joy, giving yourself permission to. I mean, I hear your laugh. I hear it's there, right? And just giving yourself more permission to bring more of that into your life as much as possible is key. So sometimes it's not doing more. Sometimes it's doing less.
I love one of the tips says, this is just me being silly, but one of them, it says Dr. Cabeca's top 11 ways to stimulate your oxytocin levels. One of them is touch more. And then in parentheses, it says appropriately, of course.
Yes.
And I'm thinking, that's a good point, and I like that. It resonated. It was kind of funny, and I totally get it. So just thought I would share.
I love it.
Yeah, so you'll have to know me. You have to let me know how you do. Retest in another month or so. But it's like choosing the disciplines that resonate with you the most. And it's funny because we have company staying at the house who have pet allergies, and so my dog is staying with my daughter at her house an hour away. My cute little Sandy, my Australian Shepherd. And so my daughter and I were in bed last night thinking, oh my gosh, we just missed Sandy. We had this sad moment. We're like, she's our oxytocin booster, and so little things like that kind of start to connect the dots. Yeah, I need Sandy here. I'm going to tell my guests to leave. No.
Yeah, I'm thinking Sandy needs to come over to hang out at my house and Tiffany's house too.
Yeah. Oh, pets are great. Yeah.
Oh, I have 4. I was just teasing. Tiffany has you have lots too, and you have a couple goats, and you have some chickens, right? And you have some dogs. What else do you have, Tiff?
Yeah, I do. Yes, chickens and
maybe
goats
those with lots of.
As a matter of fact, my goats. I had to have been an animal in my last life because my dogs have always. I'm very close to my dogs. It's almost ridiculous, but. The goats got out this morning, and so my husband usually does it, and I couldn't get him to wake up. So I was like, oh gosh. He kept saying, I'll get him, and then he'd fall back asleep. So I was like, So I got up and I put the goats back in. He goes, just grab some food. They'll follow you back in, right? And so sure enough, right, I go in there, I bring the food. They followed me in. And then they're all walking up to me wanting to be petted. So I go to walk back out. They follow me back out. I go back in the bedroom. I'm like, okay, The goats are following me. They're not just staying there. It was just funny.
They're following
I had
me.
to have been an animal. I have really strong connections to animals. I love them, and they bring me great comfort. It sounds terrible.
Yes.
We have a little black Chihuahua named Pickle, and don't ask. But
she's cute.
The kids call him my therapy dog because he always tucks in. He's typical Chihuahua, tucks in really close, and he's just therapeutic for me. I just scratching him.
I think that's important. I think it's a big deal, more than people think. What do you think, Dr. Cabeca?
About what?
Pets being,
animals,
very therapeutic and things.
Oh, absolutely. Yes, without a doubt. Yeah, absolutely.
It literally must raise my oxytocin levels to scratch my little Chihuahua.
Yeah,
it's just so
no
cute.
Doubt. Yeah,
terrible.
Absolutely. That enjoyment, right? Exactly. So very.
So
very
we need everybody to take your quiz. And then check out your store. Like I'm looking at the Jolva, and you have some helpful tips on do you suffer with, which is great. I only suffer with about 3 of them on there. So when people take your quiz, is it helpful for them? Does it help guide them to whether to take that the other cream? Is it the PPR, or does that help? How would somebody know which one to get, the Jolva or the other pregnenolone? Progesterone cream. I think
progesterone, pregnenolone, I give some good information in the progesterone, pregnenolone topic. So I would say that, definitely if there's issues of PMS, the perimenopause or postmenopausal, a little bit of progesterone goes a long way. And I would check, you can check your day 21 progesterone levels, and if it's below, certainly if it's below 10, it's normally like around ideally 15 to 20 on day 21. But if it's below 10, probably could use a little bit more progesterone. But still, even if we're symptomatic, a little bit of progesterone and pregnenolone cream can go a long way. The other thing is that if we're experiencing those symptoms, and that sounds right, I talk about that a little bit underneath some of also the ways to use progesterone. I have a video on my YouTube channel that goes into that a little bit more as well. You'll find that can be beneficial. If we're experiencing for Jolva cream, if we're experiencing decreased orgasm, decreased sensual pleasure, loss of lubrication or dryness, urinary leakage, discomfort, that can all be due to symptoms of aging and hormone imbalance. And so adding Jolva cream, call it the topical anti-aging cream for the vulva, helps to moisturize that area, helps keep that tissue healthier, and you'll see an improvement in many of those symptoms. And so that would be for that area for the Jolva cream, and that's where we're seeing the most benefit in clients.
And that's the one with the DHEA, right?
Yes.
I'm just going to buy the whole thing.
Yeah, there's a hormone harmony bundle because most people experience that they use both together. But I was going to tell you, too, that we have offer your listeners a free trial of Jolva, and they can go to order.jolva, JULVA.com/trial, and have an opportunity for a free trial, a 7-night trial of Jolva. Just pay shipping and handling. I think it's $4.95, so it's a 7-day trial for $15.95 that we're giving free, and just pay shipping and handling $4.95, and experience that. So,
will you say that one more time?
Lovely.
order.jolva.com/trial.
Got it.
Amen.
Fantastic.
Yeah.
I'm telling you, if this works, Dr. Cabeca and I have some really strong notion that it will. My husband's going to be like, please don't ever be out. He'll be emailing you and being like, you can't be out.
We had a husband say, can we order it by the barrel?
I'm telling you, can you have like the bathtub size where she could just soak in it?
Right.
Oh my gosh.
Yeah.
So what is new?
We have a
we
good
want to
FAQ
let you go.
page.
What's that? Go ahead. Sorry.
But for questions, we have a good FAQ page at julva.com/FAQ. So we've built that out to really, I hope, answer a lot of questions that may come up. You know, is this right for me? And that's at julva.com/FAQ. And that may help. I'm sorry I interrupted.
No. I was just going to say, we always love to close asking people, what's on the horizon? Any new amazing things to share with us that we should look for?
Oh, my goodness. Yes, I've been working on a book, so that will be coming out in 2018. I can't wait for that to come out. I have a couple ebooks in the works that are going to be released to my email list first coming up this fall, and one is Slim, Sane, and Sexy, and that gives you an introduction into my keto alkaline program, and I have another ebook coming out. It's called All Things V. I don't have a title for it. I'm just calling it All Things V, so maybe you can help me come up with a title.
All Things V sounds great. I love that.
Or the other V. Big O.
The other Big O.
The other Big O.
Oh my gosh. That's gonna make me think of you all the time.
Yes, I know.
Love it. Thank you.
You know, I
Wonderful.
am so incredibly grateful personally, truly that you are just amazing enough to have this topic for women.
Yes,
honestly, I don't know whether it's a social stigma or whether, you know, I think moms have a tendency and women have a tendency to always put people first. I think that's part of our design. But, you know, times are changing, and I think it's really important to address sexual dysfunction in women, because I don't think that most women are willing to just come out and talk about it. I know previously, you know, I never have been able to be honest. It's, you know, I hate to say it, but it's more of a desperation position now. And, you know, of course, doing the radio program, I know I can't be the only woman in this position, you know. And I think women have a tendency to be like, oh, okay, well, you know, she's got special circumstances, or that's different, or this different. And it's not.
Nope.
It's not. We're all in this ballgame together. So I personally am so grateful that you are spearheading this topic for women and saying, you know, it's okay to ask, and it's okay to find out what may be wrong, right? There physiologically may be something that's wrong. It's not just you and your lack of desire, and, you know, maybe you think you're overweight or think you're unattractive. There are hormones and things that are responsible for these feelings, and these, you know, for women who are very negative, and they're like, gosh, I just feel so doomsday, right? Sometimes that can just be hormones out of whack, right?
Absolutely. Yes.
So I'm incredibly grateful personally.
Yes, both of us. Both of us are incredibly grateful, and we are so glad to have you on the show. I've been talking about it. We've been meaning to have you on the show. Something always were to happened for me, and then who was it? I guess we were talking to Dr. Laura Bryden, or it was also her and Dr. Schaffner as well.
Yes, we got a couple.
Yeah, we got a couple, and I was like, I'm doing it right now. And so that's when I messaged. That's when I messaged you, because I was like, okay, she's already been on my brain. This has to happen now. So thank you so very much. I know you jumped on this one for me last minute. This has been fabulous. Take care of you, your beautiful daughter, your other daughter. Go get Sandy and let us know if you're all happy now.
Thank you.
Okay, we'll tell everybody where to find you, and we thank you so very much.
Thank you.
God bless you both. I appreciate you
very much. And you too.
Okay. Bye-bye.
Bye-bye.
How fun was that? She was amazing, talking about things.
She's amazing, and she's lovely.
Oh, she's so lovely. Oh, dreamy.
And
you know, you can tell she's got that good air about her.
Right? She's been through horrible trauma, and you know, she's back to this place. So there's hope. You know, I mean, she gives. For me, she says hope. Honestly, from illness or emotional trauma, or, you know, you can get yourself back and plugged back in. I mean, that's what it's all about.
I know. Yes, it is. Get back and plug. And, you know, creatively, my creativity I'm unplugged from that. It just is unplugged. It's like I can't even pull from recesses of like what it was before. Like
I'm telling you,
it's the strangest thing. So you really hit home for me. You know, when you said that. So she was fabulous. This was a wonderful, wonderful show. So we're very, very grateful.
All right,
to,
so I have a
Dr.
couple
Cabeca.
of tagged up a couple of places. Of course, you can find all things Dr. Cabeca, Dr. Amazing Cabeca at drAnnaCabeca.com, spelled DrAnnaCabeca.com. And then the links that she gave us, and I think we'll go ahead and post them in the Hashi's group. Yeah, Donna?
That'd be great.
So there's a order, period, Julva, and I mean period. I probably should specify period, dot. order.julva, JULVA.com/trial pack. So there is the free 7-day Julva. There is also the Ulta lab test, Dr. Anna Cabeca, her comprehensive elite panel, which it looks to be is the most popular for those that want to self-order their blood work, ultalabtest.com/Anna Cabeca, and it gives you a whole bunch of things, but I chose the elite panel. There's a bunch of different ones, and oh my goodness, right? All kinds of goodies, and then of course you can order. I'm ordering I'm going to order the Pure Balance PPR because that one screams me right there, Mama's little helper.
Well, you're going to have to keep us updated on that. Okay,
Let me
guys.
Tell you something. If I get my sex drive back, that's worth.
Don't worry. We're going to know about it. Is that what you're trying to say?
Yeah. The whole world will know about it. Everyone listen up.
I can't wait.
Oh my gosh.
Okay, guys. As always, we gotta close the show. As always, a very big thank you to our listeners. Please, if you get a free moment and you enjoy our shows, we would love a review on iTunes. You can go to my site, you can go to iTunes and leave us a note. We really appreciate it. And if you've missed any of the shows, you can download them. iTunes, Stitcher, Google Play, pretty much everywhere.
And real quick, please check out the Hashimoto's Voice research by Anna. I got to ask her how you pronounce that. Husi. I think it's really important being able to diagnose based on voice. It's some research, so you can also do that. 15 minutes for a great cause. That link is in the Hashi's group as well.
Have you tried it? Have you done it?
No, I'm doing it right now after the show.
Yeah,
I'm going to do it because I've noticed so many vocal changes in my voice. I can't even tell you since being diagnosed. So this is super awesome. A big shout out to Anna, and we would love to help her along with that research. So I posted that link in the Hashi's group. You can connect through there. 15 minutes, do it. Also be sure to check out Thyroid Nation Essentials at thyroidnation.com. Just products that Danna and I made to make your life a little bit easier, a little bit cleaner. No synthetics,
a lot cleaner.
BPA free, a lot cleaner. So take a peek at that.
Yep. A lot cleaner. And make sure to follow Thyroid Nation on all the on all the social media platforms like Facebook. And, of course, Tiffany keeps mentioning the group. That's where you can find it. If you type in Hashi's to the Facebook search, you'll find us. We'll pop up. And what else?
And make sure to tune in weekly because Danna has scheduled all kinds of amazing guests. And honest to Pete, we learn something new every week. It's just really...
We have some exciting news.
That you enjoy it as much as we do.
That's right, and we have some exciting news coming out. One of our favorite supplement and guest, Dr. Kiran Krishnan. We will be having a sponsorship from one of his lines, so we are really excited about that. That's coming up in a couple of weeks, and Tiffany and I both just love Just Thrive, so we can't wait to share more about that. And again, we have tons of upcoming great guests. I can't think right now at all. It always happens to me. I should just have it pulled up. And then
you're going to
Wendy
get
Myers,
your sample.
Wendy Myers was supposed to be on today, and she needed a break, and she did take some self-care for her. So I'm so glad. And Dr. Cabeca was able to move up her show for us, as we had her scheduled in a few months. So, okay. That's all I have to say.
Of
Sorry,
course.
keep going.
No, that's okay. Wendy, we love you, and we'll see you soon. We hope you're feeling better and glad you're taking time. And, of course, this leads right into that, but Danna and I, of course, always want to remind you that wellness is a journey and takes continual maintenance and evaluation. It's not one and you're done. You have to listen to your body on a regular basis, and don't develop a new normal and stay there. Okay, so I'm aging and perimenopause and this, so just the loss of creativity and libido and all this. This is just where I'm supposed to be at this age. No, your body's telling you. You got to check in, make some changes. This is your life. You live it and live it well. So your body tells you everything. Make sure to always listen. Right?
Yes, it does. It sure does. This is Danna, your Thyroid Nation Gringatika.
And Tiffany Mladinich.
Bringing the collective voice of thyroid thrivers worldwide so that together, united we heal. Thanks, guys. See you next week.
Bye.